Today's episode, I am chatting with Amber. Amber is a mom of one, and at the time of the recording, she's pregnant with her second. And she's also a musculoskeletal physiotherapist with an interest in women's health. So throughout this episode, she talks about the type of work she does. And sneak peek announcement, there is an episode coming up with Amber for the series Cuppa with a Pro on this podcast, where she takes us through everything pregnancy, postpartum, and pelvic floor. So keep an eye out for this one. I think it will be coming in about 2 weeks. But in today's episode, Amber takes us through her motherhood journey, which began with her having a very strong desire to be a mum one day, but wanting to establish herself in her career first. When Amber got pregnant with a son, she didn't know much about her pregnancy options, so she went to her GP and she was referred to a midwifery group practice. But unfortunately, as Amber takes us through, because of her blood clotting disease called VanWillebrand disease, which you'll probably hear that Amber will pronounce it better than I did, she was unable to meet the criteria to be included in DMGP. So she ended up doing shared care, and she takes us through feeling that lack of continuity of care and how to try and remedy to that. She educated herself and advocated for herself as much as she could, and also got her birth partner, her husband, to advocate for her during labor. Amber ultimately describes her birthing experience in the hospital as a positive one, but with more than a few frustrating moments along the way where she felt like she wasn't being heard despite her advocacy and her doula and birth partner advocating for her. She even goes on to say that she felt at times that she was being bullied into doing things the way that the midwives wanted things done, rather than the way that Amber wanted her birthing experience to be. And I think this is a very good reminder, and you will hear how Amber had to stay very headstrong and very much advocate for her choices and remind the birthing staff of what she wanted, and at times even bargain with them. And then finally, Amber takes us through her amazing breastfeeding journey and the challenges that she experienced with having an oversupply of milk, and both the advantages and disadvantages that this came with. So without further ado, I will leave you with Amber's episode, and I hope you enjoy it as much as I did. You are listening to Cuppa with a Doula. I'm your host, Alicia, exercise physiologist and doula. And every week I chat with a mum or mum-to-be about all things pregnancy, birth, and parenting. The stories you will hear in this podcast are real and sometimes raw, but they are all told without any taboo. So grab yourself a cuppa, put your earphones in, relax, and enjoy this episode. Hi, Amber. Thank you so much for coming on the podcast.
Hello. Thanks for having me.
Not a problem at all. So I guess, do you want to start by introducing yourself? So telling the listeners your name, where you're living, and who is in your family.
Yeah. So my name's Amber, and I am a mum of one little boy at the minute, and pregnant with our second, so I'm 28 weeks pregnant, and I live in Perth in WA.
Amazing. And so you are also a musculoskeletal physiotherapist with an interest in women's health.
Yes, that's right. So I've been working in the field, oh my goodness, 10 years now, which is just nuts to say. And yeah, I've been working in the area of women's health for probably about 8 years. And every year I keep saying, I'll go back and do my postgrad cert, or I'll go back and do my master's. And then here I am 10 years later, and I still haven't done that yet. But I'm very grateful because I work in a space where I get to work with a pelvic health team, but then I also work within a gym environment. And I just love working in that sort of in-between area where, I take care of pregnant women mostly, and then women, or those same women, will come back to see me when they're hoping to get back into their exercise. So I get sort of, the women that come back and need further help, I refer on, and then those that I can continue with their rehab if they're not having any issues, we get them back into their exercise and workouts. So I really do love working in that area. But I will, maybe after this pregnancy, go back and do further studies for the next 10 years.
Look, you've got time, you don't need to do it right now, and, enjoy having a toddler, enjoy having a newborn, and then you can just see, where life takes you, how it's all going, and then you can do it, potentially. Maybe not, who knows? Yeah,
that's my thought, and I've seen a lot of my colleagues study whilst having a newborn. You think, you're off work and it's a good time to. But my last sort of postpartum period, I just adored, after working very hard for many years, I just adored not having to think about work, focus on work, and I could just be in the role of being a mum, which I had wanted for a very long time. I've always wanted to be a mum, but I was never in a rush. The same thing as my studies, right? I'm like, I know what I want, but look, there's no rush. There's no rush. Got time.
You've answered my next question.
Oh, really?
That's good on you. Yes, my next question was, did you always want to be a mum? Which you did.
Yeah. So I always joke, and my mum knows this. My mum and I are very close. And I always said, like, if I didn't have a brain mum, I probably would have been like a teen mum. Like I would have had a baby like way back when, because I was always, 8 years old. I remember having like babies on my hips and always wanting to hold the baby and play mum. Can I babysit? Can I look after them? And they're like looking at this 8-year-old with a newborn or a little baby or a toddler, like dragging them. So I've always wanted to be a mum. Yeah, I sort of stuck with my studies, and at school was kind of, never knew what I really wanted to do, but then was enjoying and was doing well in maths and science and sort of human biology, and I loved that. And then landed in physio, and then with that degree, I kind of decided, no, I'm going to build up enough of a reputation in my field, in my career, so that I can come away from that and be a mum, and then will know that I always have work to go back to. And my last maternity leave, I realised that was definitely well and truly the case. And even now, I still have people that come, they haven't seen me in like 3 or 4 years, and they'll come back and they're like, oh, I've got this other problem that I'm like, oh, I thought potentially you'd gone to see someone else because it's so long. But you really do build up those good relationships. And some of my clients I have seen for like 8 years, and they'll come back whenever they need.
See, that's amazing.
My career, I was working in the hospital, so that was like inpatient care. So I've had the whole spectrum. But anyway, I've landed. I think I've timed it right, and I've landed exactly where I wanted to be. Where now I can just put my sort of mum hat on as my main role. And I just love it. It's honestly is the best thing.
Oh, amazing! And we're going to dive right into your story next, which is going to be so good. Because what's interesting about everything is obviously you being a musk physio. Even if you didn't have the interest in women's health, is you've got so much knowledge around the body. So I don't know if you did a lot of pregnancy, postpartum at uni when you learned, but having that knowledge and knowing that, your body changes in pregnancy, and it takes 9 months, but it's still rather quick changes, especially in the third trimester where you gain a lot of weight, there's potentially, lots of fluid and stuff. Having that knowledge to know and recognize, I guess, we get pregnancy aches and niggles and stuff, and recognizing that early sign and going, okay, lower back pain, need to address it now so it's not debilitating. That is awesome, right?
Yeah, I think that's what fascinates me most, and I mean definitely why I'm still in the profession is because the human body, we just don't know enough about it. I'm forever learning every single day, but then the female human body, what it's capable of, what it goes through, the rapid change that is pregnancy, and that early postpartum period, which can be from 12 to 2 years and beyond. Like, it is so resilient, and how it can morph and change externally and internally blows my mind, but I'm like, it's amazing to witness, and also as, you know, my role, I can have such a big impact and change throughout that period, pain management, but also, to optimize pregnancy, optimize birth, and then optimize that recovery. That's why I love working in this space. I think women are just incredible. I mean, human body's incredible, but women in particular.
Yeah, that makes sense. So you said you've always wanted to be a mom, but obviously you wanted to be, you know, focused on studies and then developing your career.
Yeah.
Did you plan to conceive your son when you did?
Yes. No. No. So we, and I had a feeling this question was coming because I have listened to a previous podcast episode. So we were
so predictable I am.
No, it's great, and it's a great question, and it's so funny. I did have that question asked a few times during my pregnancy, and I thought, people are curious. Again, working in the space, working with the clients that I've worked with, you know, whenever I was teaching the pregnancy classes, I was always so like, I can't wait till my turn. But we were never actively trying. But how I describe it was we weren't trying, but we weren't not trying. So we sort of had, again, similar story to a lot of people, travel plans for 2020. That was kind of going to be our last hurrah. And then with COVID, we decided to get married in June 2020. And I had come off contraception maybe it was 12 months before I actually did conceive. And like I say, it was more, I had been on hormonal contraception for a very long time, the pill for 15 years, and then I had a Mirena for 3 years. And I was just got to the point where I was like, do you know what? I just want to know my own body and my own cycle and learn my cycle. So it was 12 months of me on that journey of tracking my cycle. So, you know, we being careful, not really being careful. That's sort of how it all happened, which I just think is an absolute miracle because he was definitely made from love, that's for sure. And I did have the slightest inkling in hindsight. I was like, oh, yeah, that was pretty risky, you know, in terms of when I was ovulating. But I had quite an irregular cycle. My cycle days are quite varied, and because I exercise and train a lot doing weightlifting, sometimes it was a little bit longer than usual and very much dependent on stress and all the rest. So my cycle was never predictable, but I kind of had a rough gauge of where we're at. So on those times of being careful, it would be like, oh, no, maybe this is the time we need to be careful. And there was other times where I was like, we're just going with it.
Yeah, and sometimes that's kind of what you need because sometimes like you know you want it, but then you don't really want the stress of going, okay, we're officially trying, you know, like let's make a baby, because that's sometimes it's a lot of stress, you know, especially when like, you know, so you know your ovulation window-ish, and then you've got to wait, and you know, you've got to wait, 2 weeks, and then you go, oh, am I pregnant? Am I not? And then you test or you get your period and you're like, oh, okay, well, I mean, there's always next month. And I think it takes on average 10 months to conceive when you, I guess, actively try. So, you know, some people conceive like within 2 weeks of starting, and others take a year, you know. Sometimes, you know, all you need is that really little push
to try. Like we were more not trying not to fall pregnant for many ways. But like I say, I'm a big believer. It was meant to be. It was meant to be. The biggest thing was we did have. So I had I'm pretty sure it was. Yeah, I had a powerlifting competition that was upcoming, and I ended up still competing at 12 weeks. Pregnant, I decided to still go ahead with it. But yeah, we had I wouldn't say other plans, because what was it? We got married in June, and then I found out I was pregnant in September. So it was a few months after our wedding, which again, I'm like, in hindsight, everything worked out as it should have. But that was the biggest thing that I was like, oh, you know, I should maybe cancel this competition, and end up going through with it, which it was a great experience. And funnily enough, this pregnancy, I was training for another powerlifting competition, and I had to cancel that one because I fell pregnant, and I would have been a bit further along. I think I would have been about 18 weeks. And
okay.
So anyway, that's just another funny story that I was like, I still haven't been able to do this powerlifting competition, not pregnant, or, you know, actually do my training and get it done. But maybe
that's so funny. Well, you know, I mean, there's always next year if it's every year.
Yeah,
Maybe.
yeah. So
Depends, obviously, but
maybe.
oh, that's amazing. Wow. Did you find out pretty soon after that you were pregnant?
Yeah, so the funny story about that was I was about 10 days late for my period, and I often talk to my girlfriends about, we share, and I'm a big oversharer, so share everything. And it was one of my friends said, "You can be pregnant." I was like, get out. Like, it was not on my radar at all. Like, even being 10 days over, I was like, oh, this happens sometimes. Like, it's no big deal.
Yeah.
Anyway, it was my bestie that said, go to the chemist and get a pregnancy test. Now, I'd never taken a pregnancy test before. This was my first pregnancy. I'd never accidentally fallen pregnant, or never had a pregnancy, or had any miscarriage or anything. So I was like, pregnancy test, right. Okay. So I took the test and I was like, oh yeah, cool, it's nothing. And my friend, who's also a midwife, she's like, send me the picture. She's like, I need to see it. I need to inspect it. And it was her that said, Amber, there's a faint line there. She's like, you're pregnant. And I was like, what? I was like, I've never looked at one of these before. I didn't know that you really needed to look that close. So, yeah, she knew before that I did.
Oh, that's hilarious, actually. Like, I mean...
So, yeah, it was a big surprise, and then that was a big surprise. And, yeah, anyway, it was telling my husband when he was like, oh, there was a day or so where we were like, is it or is it not? And funnily enough, I actually had a procedure at the hospital. I had to have a colposcopy the next day, and I said to the gynae, I said, there's a chance that I could be pregnant. And he did a urine test, and he's like, congratulations. I was like, oh my God, okay, this is real now. Oh God. So I called my husband, and he was just like, all righty then, this is what we're doing, this is where we're at. So it was really not what I had expected, with the anticipating, and it was just like, oh wow, that was a surprise. So the best surprise, it was the best surprise, really.
Oh, that's amazing. Well, see, that's good. As you said, it was just meant to be.
Yeah.
At that time.
Yeah.
And, things in the universe were aligning for you. And there you go, you're pregnant. So how much did you know about pregnancy in terms of, the options for cares you had, around you, and what to do next and all of that?
That's a brilliant question, because I find even still now a lot of my clients are so confused about this, and there's not enough education out there about what to do as soon as you find out you're pregnant, what your options are. And I think that I had truly learnt from the women that I was working with, and when we'd have the antenatal classes, share how far along you are, if you want to share if you're having a boy or a girl, or where you're giving birth. And that's how I realised about the options. And originally I was working in a private hospital, so there was a lot of private obstetric care, which is one of the reasons that I decided I definitely didn't want to have private obstetric care working in that area. But then learning about the public options, and then it was through my clients that I learned about the community midwifery programs, which I think they're slightly called something different over East, but the MGP, or we call it the CMP here.
Okay, yeah.
And group midwife practice, essentially, and then the family birthing centre options. So, I learned that from my clients, and I wouldn't have known otherwise. But I still, I don't know, I have had that knowledge of, you go to your GP, you confirm your pregnancy, you discuss with them your options, but I still feel like that's tailored around what they know, really.
And I can tell you, from my own experience, for my 2 pregnancies, I've had 2 different GPs, right? And the first one was really good at knowing the options, because I didn't know anything for my first pregnancy. So I thought the same as you. You go to your GP and you say, I'm pregnant. I don't know. I mean, I knew of the hospitals around me, but I was like, I don't know. They were both equal distance, and, I don't know. And so he helped me with that. And then this pregnancy, new doctor, she barely knew what the word pregnancy meant. So this time, if I had her for my first pregnancy, I don't know what I would have done, but it wouldn't have been really pretty. I had, for this pregnancy, to go and tell her what I needed, including the referrals, and also tell her what a new called translucency scan is, and explain to her what happens. And I was like, I'm pretty sure you should know about it. I don't know. I mean, you're a GP. So some women are blessed to have a GP that has knowledge about pregnancy. Others aren't.
Yeah.
And that's such a problem.
Yeah, you spot on. And I think, especially if you haven't got a well-known, someone that you see regularly.
Yeah,
most until I don't know, until you have a family really where you're going to the GPs more often than usual. But I never went.
That's
to
right.
doctors, so
No,
was
that's
kind of
right.
more
That's right.
a convenience of whoever was available at that time. I didn't really develop a relationship with the GP until this time around. I've decided I'm seeing a different GP as well, but I'm going to the clinic where I've been taking my son, so a family clinic, so that we're all at the same place. And I did pick a GP that did have women's health experience. And to be honest, I think she's been very thorough with a lot of things. So yeah, very happy with that. But again, if you go to your GP, you assume that they know.
You do. And it's sad when you find out that they don't, or you find out that they didn't refer you early enough for those, community midwifery practices where you usually have to be in there early, not at 15 weeks, you've got to be in there at like
8 as soon as you find out.
Yeah, depending on, for me, with my first, I think the referral was sent at 13 weeks, but I lived, rural, so smaller hospital. Still, I don't know how I got in at 13 weeks, like chance, totally. I've heard of someone in Wollongong who missed out. The referral was sent at 5 weeks and she didn't get in.
Wow.
So what more can you do?
Yeah,
so
it's about 8 weeks for myself, and that they were saying that they were already full, but that was first time around. But that I also didn't meet the inclusion criteria. I was part of the exclusion criteria with my blood disorder.
Oh, right. Do you want to talk about your blood disorder? I could not remember the name right now.
Yes, VanWillebrand's blood disorder. So it's where I'm lacking in some clotting, a particular clotting factor. There's usually either you don't have any, your body doesn't produce any, or your body doesn't produce enough of the clotting factor, so you're more at risk of bleeding or blood loss. So one of the exclusion criteria was clotting disorders. So I did still apply and try for the odd chance that they would let me in, but no, they didn't last time, and I tried again this time, and they're like, nope. So we will probably come on to talk about, but I've recently changed I was in the public system for my first pregnancy and birth, and at 20 weeks this pregnancy I've decided to change care from public to a private midwife now.
Oh, nice. Can't wait to dive into it. So so back to your first pregnancy. So you applied for that community midwifery group. You didn't get in because of clotting factor issues. So did you then do shared care?
Yes, it was shared care with my GP up until the 20 weeks, and then I was through the antenatal clinic at the hospital 20 weeks on. But even still for that, it feels like it's such a big gap. I remember thinking, like, the first part of pregnancy, you really feel lost, hey? Like, it's like, definitely. Who do I go to see? Like, does anyone care that I'm pregnant? Why is no one asking me questions? But it was up until 20 weeks when then they started the monthly appointments, and then sort of more frequently. But my GP got the ball rolling, and then sort of wait till you hear from the hospital, and then I did start those appointments there.
See, I'm the same. I think the exact same. Like, you're left to your own device for your first trimester and into your second, almost halfway through. And I don't know, like, I know you've got so much time to prepare for the birth, and there's a lot more, I guess, questions that arise, in the second trimester and your third one. But I had so many questions in the first trimester, and it was like, oh, well, you'll need to ask your midwife. And I'm like, but my midwife doesn't want to see me until I'm 16 weeks, and I'm 9, and it's a long time away right now. 6 weeks. And
that was with was that a known midwife to you? Was someone that you were able to see?
It was. For my first, I was in you guys call it community midwifery. We call it midwifery group practice. It's attached to the hospital, and you've got either your own midwife or a group of 2 or 3 midwives. So in case, one is on call or, on leave or something during the time that you might birth, then there's someone else that you might have seen and who would be there at your birth, hopefully, basically. So at least I had that. Did you? So It is, and honestly, you just feel so lost when you don't know your options, and then you get told wait until you get a call, and then you get a call, and then it's like, okay, we'll take your details. Oh, your next appointment's in 6 weeks, and you're like, oh, so like nothing's happening between now and 6 weeks, like, or 4 weeks, like, but I've still got a lot of questions, and it's like, but you told me after 16 weeks, I would see my midwife.
Yeah.
And I found that really frustrating too. And I know that, not a lot of things happen technically, and you haven't had your anatomy scan, so they kind of don't really know what they're in for. But you've still got a lot of questions, and unless you've got a private midwife, I don't feel like you're very supported up until really the third trimester. Like the second trimester is still really sporadic, maybe monthly appointments if your midwife, isn't on leave, there's not too many public holidays, and they're not sick, basically.
I think the hardest thing is for those women. I mean, I had quite significant nausea. Like I was very sick for both of my first trimesters up until about 16 weeks. But for the women that don't have that, the unicorns, I think it's 15% of women that don't have any symptoms, nausea, and yes. But I feel
first pregnancy,
because when you go, okay, am I even still pregnant? Like the fact that I felt so sick, I was like, I'm definitely still pregnant. But because you're not showing and you don't really, you're like, am I pregnant or not? Like I think that can be a real source of anxiety for some, especially if they're like, they've been trying for a long time and all the rest. So in a sense, I'm like the nausea, like constant all day, every day, and feeling like absolute death was a reminder that I'm like, I got something going on inside me.
Yeah, and see, I found that, again, I had so many questions in my first and second trimester, but I didn't feel kicks until maybe 19 to 20 weeks because of my placenta, because it was anterior at the front. And so I wasn't showing much. I barely had any bloating, whatever. I didn't really have nausea. I didn't have vomiting. And I was like, okay, are we sure this is happening? Do we know this is happening? And you don't have any scans either. You do your translucency scan at 12, 13 weeks. You don't have anything until 20 to 21. That's almost 2 months in there. Yep. So I'm like, okay. And it's like, don't use a Doppler on yourself because, you might get yourself really anxious. So I got myself a Doppler. I'm not a midwife. I couldn't pick up anything, but I thought I could. It was so limbo. It's like you're pregnant, but I didn't feel pregnant. So I was like, well, maybe I'm not. And I had a miscarriage too. So I was like, well, maybe something's happened. I don't know. I can't check. This is a source of anxiety for me. And then once I started feeling kicks, I was like, okay. Yeah. Good. Yes. Anyway, let's talk about me. So you didn't feel really good in your first trimester. How did you manage work? That would have been awful.
Yeah, that was tricky. So reflecting, it was a time where I remember it significantly because my husband was doing like a drive-in, drive-out role. So he was away for work Monday to Friday and then would come home on weekends. And I mentioned that because I was so sick that I was completely put off all vegetables, all salads, and being vegetarian, that was actually a big deal for me. So I literally lived on tuna noodles and potato gems, and I was like, luckily I didn't have to prepare and cook meals. Like I was literally just surviving. But at work, I was, grey. I was, I had a few episodes of vomiting where, I tried the toast and then I tried oats and the oats came up, and I'll try, smoothie came up. I was like, right, but there's only so many other options that I can eat. So yeah, I remember just being really, really, really unwell. And after my clients, I'd sort of truck through the day, and we, in our first pregnancy, we didn't tell everyone until around that 12, 13 week mark. This time around, we told everyone much sooner, around 9 weeks. But yeah, when people don't know that you're pregnant and you're really struggling, that was really hard. And as soon as my last patient would leave, I would lay on the bed and have a nap and just like, I wouldn't move. Like, I can't be upright anymore. But I was often thinking, I want to be the one laying on the bed right now.
Yeah, but, definitely.
It was brutal. It was pretty hard. And first pregnancy working, like I was working full time. It was tricky.
Yeah, the mental load of being a working woman,
Yeah.
and then, returning to being a working mum is something we don't talk about enough. But when you're pregnant and, first, second, third trimester, working full time is actually not that easy. And people go, oh, you're just pregnant, you're not sick, it's got an end date. Yes, but it's actually really hard. It's a lot harder than people imagine because, well, first trimester, most people feel way off,
Our maternity leave.
Yeah, definitely. Yeah, but then you want to have some for
Yeah.
later. But it's really hard. And in second trimester, you feel better. But then third trimester, that's when, there's potentially, swelling of the legs, swelling of the ankles, having, cramps and heavy legs and reflux and not feeling, and again, you're back to not feeling great and you have to work like 5 days a week. It's totally insane. It's the society we live in too. I mean, we obviously don't have to work full time. Some people do. Society tells us we have to, obviously, and then you can take maternity leave, but also come back quick to your job, It's like, but then also don't put your kid in daycare too early because, well, that's not good. But also go back to work.
Yeah.
There's I honestly don't understand the societal, I don't know, like narrative around pregnancy and then return to work as a mother, and how as a society I don't feel like we accommodate really well for mothers. Places like Sweden do. We're just not good at it. Like we have maternity leave, amazing. It goes for like what, 4 months maximum if you haven't got, a job where you can take more. 4 months returning to work.
It's not much. Yeah. I ended up going back to work around 8 months, which was a little earlier than my planned 12 months. But and that was because my leave cover was sort of leaving, and it was kind of the right time, and my husband was in between jobs.
Oh, yeah. Okay.
Cool, I'll pick up a day and we'll sort of go from there. But even 8 months, I was like, I'm not ready.
Yeah, I was going to ask, did you feel ready? Did you have to put your son in daycare at that point?
No, so I'm very grateful. He still doesn't go into daycare. I only work 2 days at the moment, and I sort of started with one and then picked up 2. But my mum has him on one day, and then my mother-in-law has him on the second day. Yeah, I'm ever so grateful, and they love it. They have their one-on-one time, and he loves it. But at the moment, alternate Fridays, he does go into the creche, because where I work is within a gym facility, and they have a creche. So from 8:30 till 12:30, I just have sort of shorter day on those days, those fortnight days.
Yeah.
So we kind of get the daycare experience in terms of all the germs and bugs, and he ended up getting a hand, foot and mouth, which was awful. But I'm like, we have that experience, but I haven't actually we don't have daycare as such.
When it comes to daycare, I mean, there's a lot of like talks about what's right, what's wrong. What's right is what works for your family. So for you, having grandma's day, perfect. Yeah. And creche, perfect. Gets a bit of socialization, a bit of germs, as you said. Yeah. There you go. Same as daycare, What else could you ask for?
And my husband and I, we sort of agreed that, thankfully, that if I was going to work more, that I would need to put him into care. I was saying that I would actually rather be at home with him, just again with wanting to be a mum and wanting to spend that time in these special years together. So the 2 days works really well. And again, if I didn't have our parents to help us support us, I would be happy to drop a day and just be with him, because especially these, my sort of mindset is the first 3 years, and I know how impactful they can be on their development as well. So I'm like, I would rather be with him than pay someone to take care of him.
Yeah, exactly. And again, I think
that's and I 100% understand why other people do what they do, but that's my sort of take.
Yeah, that's right. And it works for you, and that makes sense for your family. Perfect. So how did you find the hospital care once you actually, got into the swing of hospital care? Did you see a different midwife every time, or was it a bit, maybe you could see the same one based on schedule?
Yeah. So the overall experience was actually really good. With the sort of the appointments, and I was very grateful. Like, I was well aware being in a clinic and you could be waiting a long time, but it was fairly efficient, and I did see, by chance, a midwife twice, but she was also pregnant at the time, so there was no chance that I was going to see her around my birth. Yeah, so it was sort of a different, the first appointment being mostly the questions and the family history and all of that. And then I'm pretty sure I saw her again for the second appointment. But yeah, thereafter it was a different face every time. I also made the most of going to the all the education, free education that the hospital offered. So I went to Breastfeeding Matters education, which was about 2 hours, and got to meet some of the lactation consultant and midwife that also worked in the ward. And I did another one that was, actually I missed out on the active birth class because I went into labour at 37 and 4, and I had planned that for the Saturday off, so the Wednesday to the Saturday. So at 38 weeks I was going to do the active birthing class, but we missed out on that. The other, I think I went to one more that was about one on breastfeeding, one on active birth, and there was another one that they'd offered that I sort of just made the most of whatever they had on offer. So getting comfortable with going to the hospital, knowing sort of their, I guess, understanding a bit better their policies and procedures, which is what I sort of really wanted to know a lot about, because my background being well experienced in pregnancy and then postpartum, I was really missing that birth education, which I went to do a lot of my own as well. But yeah, I made the most of the free services at the hospital, which I was very happy with as well. Yeah, overall the antenatal clinic experience was good.
So I think you've kind of started to answer the question anyway. So did you find that birthing education was enough, you know, the one you were offered at the hospital, or as you said, did you seek more? And what did you do to help you to feel as prepared as you could be?
So I am now a self-confessed birth nerd because it just completely fascinates me. Even when I'm not pregnant, my husband's like, "You watching a birth video?" I'm like, yes, I am. Birth is amazing. It has a distinct sound to it most times. But I did, so I was reading a lot of books and listening to a lot of podcasts. I also did hypnobirthing, so we did 5 weeks, over 5 weeks. The practitioner was actually, she's a friend of mine that I studied, so she's also a physio. We studied together at uni, so she's a very good friend of mine, but she also does hypnobirthing. So we did the course with her, which was like, that was extremely valuable for me, but also for my husband to understand that birth doesn't have to look like what it looks like on the movies, that it could be completely different. So he got more out of it than I thought, and I knew going into it that he was a bit reluctant, that he was like, I'm doing it because you want me to do it. And then he was just coming out with all this stuff like, oh yeah, I remember this from this. I'm like, you were listening? Those 2-hour sessions, you're actually paying attention. So, yeah, that was really helpful, the hypnobirthing. And I also did a breastfeeding course during pregnancy, which I can 100% recommend for any pregnant first-time mum and anyone that wants to breastfeed that maybe didn't have a successful journey their first time round. But that was invaluable, because once I got to the position where I needed to troubleshoot what my situation was during those early days, I was able to refer back to the short videos in the course, but there was a whole section on pregnancy of how your birth and your labour can affect the early breastfeeding journey as well. So that, I guess, my pregnancy education was around the hypnobirthing. I was hoping and planning for a spontaneous vaginal birth, so that's all the preparation that I was doing for that. And I'd also had a doula. So she was also a critical part of my pregnancy, where she gave me a workbook that, rather than saying, actually I have it literally right now with me, rather than saying like, here's a book, go and read it, it was like, what is Panadol? How does it affect labour? And you actually had to go through and do this kind of homework yourself, and went through all the different pain relief that could be offered, went through all the different interventions. Like I learnt about the fetal scalp electrode, which we did end up having as one of the continuous monitoring methods, learning about intermittent monitoring, learning about continuous monitoring, knowing the difference between them. So rather than saying, here's the information, go read it, it was, here's a workbook, go fill it out. And that was really, really valuable for me. Again, I thought I knew a lot about the sort of working in the medical sort of environment, the hospital setting, but birth is, it is completely different. The physiology, again, amazing. The hormonal dance, all the rest of what, normal physiological birth it's absolutely incredible. I was really like, birth nerd started from last pregnancy, and it's kind of just not stopped.
No, that's right. It's what happens with our body is beyond amazing. We create a new human being. We basically create milk from nothing. Well, from blood mostly and fluid, instincts, and there's so much that happens, hormones. It's insane. And it's different for every pregnancy too. So, just because you've had this in your first pregnancy and this labor doesn't mean that will be the case for your subsequent pregnancies and labor. It's mind blowing, and I think there's so much to learn, but you don't just learn it all for your first and then for your second you go, oh well, I know it because I've been there. There's still so much to learn for your second because, things are probably different because you've got one at home. And also the way your birth and labor went will probably affect the way you may or may not want to birth, where you want to birth, and all of that. And therefore that completely changes your pregnancy, and that probably changes your postpartum outcome as well. And most people might also see that first time around, they were not prepared for after. I mean, you did breastfeeding education, which is actually, I can't say I've heard it often, because it's something that we kind of go, well, I mean, I've got the breast, surely I'll know what to do and baby will do. And sometimes it is straightforward, but for some people it's not. And when you're sleep deprived, you're exhausted, and you're trying to troubleshoot breastfeeding, that is a lot on your plate at that point. So for you, having done that education before, fantastic. Wow, you were ahead of the game for sure. That would have been invaluable. That is for sure. Wow.
Important for me to, I would say, have a successful breastfeeding journey. That was really, really a high value I had. And again, working with mothers so in physiotherapy, we can offer ultrasound therapy for blocked milk ducts or painful breasts, and also laser therapy, which is for painful, cracked, blistered, bleeding nipples, which I saw a lot of in my time, and I understood that a lot of that was related to poor attachment, and we referred to the lactation consultant, and the woman would see the lactation consultant, but we'd also offer these treatments in the hospital, but also in that early period, and even some of the mums that were extended to breastfeeding, when they got teeth, they would have changes and then they'd get nipple damage. So I learned along the way that it's not smooth sailing, and that was really important for me for it to be. So I thought, no, I'm going to learn as much as I can about it.
Wow.
And during pregnancy, when you're not, as you say, sleep deprived and in those high emotions, and having known that beforehand was invaluable. I didn't mention, but it's the Thompson method breastfeeding course. It's been around for a very long time, and the access is lifetime. So I'm actually planning to review it again with this next breastfeeding journey, and keeping all my sort of feelers out, paying a lot of attention to different types of problems that you might be able to encounter, because I did have an oversupply last time, which has its challenges, and this time I wasn't blocking out any information about potentially having a low supply. So just because I had an oversupply last time, I'm not assuming that will be the same. So I'm just keeping sort of my ears open and learning about everything all over again.
Yeah, good. And I think that's how it should be, because you just never know what's going to happen. Obviously you probably have a plan or preferences for your birth, but we know that birth, it doesn't go to anyone's plan. Sometimes it does, sometimes it doesn't. Sometimes things change, and maybe you go from a vaginal birth to an emergency C-section. That affects obviously breast milk production. So it's good to just have an open mind, just like you would go into birth with an open mind and go, this is what I'd prefer, but if those things happen, then I'm happy to go with that. Then that would be the same for breastfeeding. You'd go, this is what happened last time, but I can recognize the sign of, low supply, or the signs of, a tongue tie, or the signs of this. And then I can find either the right support for me, or I can troubleshoot it myself and then, see how it plays out. Yeah, 100%. Perfect. Okay, so you did your birthing education. You finished your hypnobirthing before you gave birth. Excellent.
Yep.
Wow, you went into spontaneous labor at 37 weeks. That, for first-time mom, that's not very common, is it?
No. So I was definitely in shock. What just jogged my memory was I had visualized my birth to be in water, and I had actually organised to pick up a birth pool that I was going to be taking to the hospital because they couldn't guarantee that I was going to be able to get the one room that had the birth pool, and there needed to be someone that was trained, and if they weren't on that shift, and I said, look, I'm not willing to take chances. I'll get my own birth pool and I'll plan to take that to the hospital. I have a doula. My husband would be able to help set that up.
Yeah.
So that was the plan. I didn't actually end up getting my hands in the pool again because I went into spontaneous labour at 37 and 4. And it was a big shock, and it was actually my husband who said, I'm just having a little bit of poo cramps. I thought I'd had a bit of a sore tummy, and he was like, maybe you should time these poo cramps. I was like, what? Time them? He was like, yeah, maybe. And I'm like, nah, no. And I did have a little bit, I think the back pain started soon after. But anyway, I slept through the first 4 hours of my labour thinking that it was a sore tummy. So I'd done a park workout the day before. So that was going to be my final workout before taking 2 weeks to just chill out, veg out on the couch, read books, relax before my upcoming birth. But it was the day before, so I thought, you know what, my back's got a bit of DOMS. I'd done some lunges and squats, and I'd walked to the park and back with my dog. So I was just like, I'm a bit achy from that. So my back was a bit tight. And then, the tummy pain. And I thought, okay, got up, made a Milo, opened my bowels, went back to bed. And 4 hours later, I woke up and I remember rolling around, like I was laying on my side, I was on all fours, laying on my other side, on all fours, I was like, I just can't get comfortable here. And and the reason I said I was messaging my husband because it was like 4 o'clock in the morning originally, but he was down, drive in, drive out. He was at work 2.5 hours away. So he's like, I think you need to time this. So I thought, okay, I'll just put this little timer on to see what's going on, if there's any pattern. By the time I got up at 8 o'clock, I went outside to feed my dog, and I squatted down to like scoop up the biscuits, and I just heard this pop and then a trickle of water down my leg. And I was like, wow. I was like, he's right. It is. Because I always thought that my waters broke first, but then looking back, I was like, no, they were early signs of cramping for 4 hours that I slept through. So it was kind of all systems go from there. As soon as I came in from feeding the dog, I called my doula straight away. She's like, wear a pad, just check to see, just to collect any fluid. We can see what's going on. Yeah. And I did notice I actually had meconium in my waters, which was one thing that I didn't learn about during my pregnancy. So I knew what it was when I saw it. It was sort of like a mustardy, sort of yellowy colour. We're going to get into details here with a clear liquid, and then there was kind of like a little speckle of blood. So I was like, yeah, this is definitely something. And I mentioned it to my doula, and she said, look, it's completely up to you how you're feeling, but if you wanted to go to the notify the hospital, as soon as you do, you will kind of be on the clock, and that's the way that will work. And I really had in my mind that I'd want to stay at home for as long as possible for my labour. She was sort of just liaising with me and saying, to see how you go, see how you're feeling. I said, look, first things first, I need to get my husband home. He needs to help me put this TENS machine on. So that was a 2-hour drive turned into, I think it was an hour and something. He made it home. He put the TENS on for me, and it was on right from then. My contractions really started as soon as I had that first trickle. Everything was all systems go. A little bit, I think the back pain started soon after, but so from I think it was 8 until maybe 12, it was about 4 hours of and this is a funny thing. I honestly not for 1 second did getting in the shower or getting in a pool or getting in my fitball or my mind didn't even go there. I was just in this zone till Hubby got home. He put the TENS on. I was on all fours on the bed, rocking, swaying. He was tickling my back, and I was just taking every contraction as it came. And it kind of got to the point where I was like, oh, I'm feeling a bit uncomfortable that if I left it any longer, I probably wouldn't be able to get in the car. So I was like, I should probably make the call to go to the hospital. I thought I still had 24 hours ahead of me before I would meet my baby, but I did not.
Well, that's a good thing. I'm happy for you that you didn't have to wait another 24 hours.
Yeah, because I had this expectation. First labour, you'll likely go over. You'll likely labour for a long time. So I sort of funnily enough, I did manifest a 6 to 8 hour labour, and if we don't count the 4 hours that I slept through, I mean, if we do, it was 8 hours, but it was 4 hours of me being awakened and aware that I was in labour. But I was very comfortable at home. It was really nice. My doula sort of only made it maybe about an hour before we left for the hospital. So having her and my husband, it was just a really beautiful experience at home. So the transition getting into the car took me like 3 contractions to walk from my front door, like not even 5 meters to the car. Couldn't sit in the car. I had to kneel on the ground with my elbows on the chair, with my head drilling into the backrest because there was a lot of pressure in my pelvis. Yeah, I think it was 7 minutes. Yeah, I lived very close to the hospital. I had another 2 or 3 contractions on the way. And so when I got there was originally my sort of, I didn't want to have any vaginal exams, and I was aware, and this is what I learned from the hospital education sessions, is that if you're only 4 centimeters, then generally they send you home, and you're not truly in. I didn't want to know about my dilation. I didn't want to have a vaginal exam because I know that can just interrupt the normal process of birth. But I declined, and they essentially. I got bullied into like, oh, well, we can't admit you. I'm like, I am clearly ready to push my baby out.
Wow.
So anyway, I agree, oh, you have to lay on your back on the bed and so we can check you. And I said, look, okay, I'll agree to it after declining 2 or 3 times. I said, I'll agree to it, but I cannot lay on my back. I was wheeled up to the maternity unit on the wheelchair, kneeling. The support person at the hospital was like, sorry, to my husband, you're going to have to push her because this is not safe for me to push her. Yeah, I was kneeling on the chair, arms on the backrest of the wheelchair. Got to the ward and I said, I'll agree if I can stay in this position. So I got onto the bed on all fours, but hands on the backrest. So I said, I still don't want to know, but they did tell my doula. And my doula and my husband, being sort of an emergency to get their head parked in the drop-off bay, like quite quickly, that they're like, okay, we'll just go down and move our cars. And the midwives were like, don't go anywhere. It's not time to go and move your car. So then in my mind,
don't give it away now.
I was like, okay, right. Yeah, from there, this is kind of where, like, I still perceived my birth to be a positive experience, but there was a lot of things that I now see as frustrations where I was informed and I had made my decisions and I was coerced into things that I didn't originally want to have for not that they were always medically indicated, but it was more that there was made to seem like there was no other option, and there wasn't, like, we weren't educated about our options. We didn't have time to, I mean, there was not really any time to think about things. But yeah, so I'll continue on from there. So essentially I was 9 centimeters, which I found out later, and I was already having these urges to push. So I could sort of feel that, involuntary urge to push. But because they couldn't get a good reading externally with the intermittent monitoring, they knew that I had meconium. They couldn't get a good reading. They started this is where it kind of was just like everything was made to be an emergency. And for me, I would have loved to have had more footage of this. I was in my husband's bathrobe. I had like a sleeping mask on. I was literally in my own zone. Then I was getting wheeled from the maternity unit back to the assessment unit, back to the maternity ward, and I was like, I had this split-second thought with all this chaos that was happening around me. I was like, are they taking me to theatre? Like, is there something actually really going wrong here? Yeah. Because up until then, I had felt so like I could feel my baby moving. I was so like in that zone and trusting in my body and working with my contractions. And but yeah, it sort of gave me this split-second fear of like, is something actually really wrong here? That was, again, not well communicated to me or my husband or my doula about what the whole situation was. But I actually did get my hospital notes to try and paint a better picture about everything that happened, but I believe it was because of the meconium that they were most concerned about, and not being able to get a good reading for his heart rate. So they said, right, we need that. Literally, I had the big bossy midwife. That's what she said. I am the big bossy midwife. You're going to get on the bed and you're going to lay on your back, and we need to get this baby out of you right now. And I was like, is this a movie? Like, is this a prank? I could not believe that was the situation. I was just like, I'm ready to push. Just let me have at least 2 or 3 pushes to like let this happen on its own. Anyway, so they did the fetal scalp electrode, which again, I was well aware that it is inserting a hook into my unborn baby's head. Like I was, everything that sort of was like made to be urgent, and it was kind of this fear that was built up. They needed to do the monitoring, and then they said, we need to get the baby out. So I was in the lithotomy position, not great. I was most comfortable on all fours. So I was on my back, and they essentially said, okay, we're just going to cut you. And I was just like, you're just not going to do anything. So I declined the episiotomy, and they said that we need to use the vacuum to get baby out now. And looking back, I was like, I think I had one contraction without them coaching me and saying, right, the big bossy midwife telling me what to do. I was just like, I didn't even get to have, I think I had 3 pushes and then he was here. So it was actually a very quick birth within about 15 or 20 minutes, which I know is not ideal for the pelvic floor in terms of it being able to stretch and move.
You also didn't choose this. You didn't say, I would like to have a 15-minute push time.
Yeah, and that kind of was a big thing for me, that I was like, I didn't even get to have that without them pressuring me into it. But anyway, so he was here within a few minutes. They cut the cord straight away. We wanted delayed cord clamping, and we said, no, my husband intervened, no, we want delayed cord clamping. And then my doula reminded, like, actually, this is what we want. And I said it, like, no, we need to cut the cord. And looking back at my notes, it was because they thought that he might need to be resuscitated. But there was, as soon as he came out, he was breathing, crying. There was no need. So anyway, that was a bit of a shame. But I just felt like a lot of things like that weren't communicated well to us because everything was in such a rush. So I'm like, in hindsight, maybe I left it too late to get to the hospital. The team didn't really know me. I wasn't even admitted. I didn't even get a wristband. Like it was very rushed. And I think they freaked out with the meconium, not being able to monitor him. So we didn't know it was a boy until then, and it was quite funny because we've got a photo. I wanted to announce the gender, and like they had pulled the baby out, and you could very well clearly see his penis, and I was like, oh, it's a boy. I'm like, I was the last to see and know, but I was the first to announce it.
But, and that's what counts.
Yeah, it was, and that the moment from then, that was, it was like, okay, my baby's here, everything's all fine. I did have labial tears, which may or may not have needed repairing, and we did opt to have them repaired. But I only had gas. I didn't have any pain relief. So that was the most painful part of my whole birth experience, was having stitches so soon after birth, which definitely affected I ended up getting the shakes, and then because I was shaking so much and laughing from the gas, Bob was he was doing the breast cord, trying for his first breastfeed, and I was laughing so much that he was moving, and then I was in pain from the stitching. He had to go under the heat lamp for a little bit. That was the whole story.
Wow, that's your story is not uncommon from what I hear, and it is so sad to hear that women are informed. They know what they want, they know what they don't want, and then they get bullied by the hospital, by midwives, by obstetrician, so that they get the thing they want. That is literally it. So they just wanted to bully you until you said yes to a vaginal examination. The evidence behind getting a number, because that's all it is, at this point in your labor, like I'm pretty sure it serves no purpose. Would it matter if you had been 6 compared to you being 9? When we know that labor is not a uniform dilation, it can happen, you can be 6 centimeters 1 minute, and then 3 hours later you're 6.5, or you can be 6 centimeters and within 10 minutes you're 10. The bullying just to get a number or just to get the thing they want by the hospital, it just pains me.
Like, can you not tell by my body language that, like, because, one of the midwives in the education session said, you know, if you call up on the phone, generally we can tell by the way that you're talking, the conversation that you're having, how far you're
That's right.
When we look at you, we'll be able to tell. And like I was like trying to hold back the pushing. I'm like, how could you not tell that I was ready to go? Like, so anyway, that was and the midwife herself was fairly, and for me to, as a labouring woman, to pick up that a midwife is very inexperienced, that she wasn't confident in her own skills of being able. It was probably her first vaginal exam she'd ever done, with the woman being on all fours. Like, I'm sure that every other exam was on the woman was on her back because she wasn't confident, and I could pick that up.
Oh, that is. I mean, it was a positive outcome, and as you said, you know, you take it as a positive birth. Fantastic. It really highlights that there is a problem in the medical system, and by medical system I mean hospital, because they've got policies, and I understand that, you know, they have to have guidelines, you know, things that rule their decisions so they kind of know what to do. And I mean, you know, your baby had meconium. Okay. But as you said, you know, an experienced midwife, or a midwife that, you know, has had sufficient clinical experience, which I believe, you know, even student midwives, you know, they have to do placements, they have to do however many hours, they would see that you're about to push. Usually when you're about to push, you're pretty dilated. Really. Yeah. And I mean, it's not funny, but that's the terminology that comes up to my mind.
Trusting the women. That's the sad part, isn't it?
And when you do the birthing hospital education classes, they say you can decline things, you can say no, and you did, and yet you can't say no now to a vaginal exam somehow. Yeah. That is just terrible. That is terrible practice. If you're declining, you know, your husband's declining, your doula's declining, everyone's saying she doesn't want it, and they're still like, oh no, but we need this number to do what with? It's insane. Just, as you said, trust you and literally look at you to go, okay, she's pretty in labor right now. You know, if I just wait a bit, I will see that she will start to push on her own without me having to say, oh, Amber, you should start pushing now. You know, as you said, you might have had a maybe less experienced midwife. Who knows? But if you can't trust the person you're birthing with, how can you have a great birth?
Really? And I think that was another thing with the whole coached pushing. I knew that I didn't want coached pushing, and it did take me out of my body, which I was so trusting the whole process. Like, it was leading the way. Like, you know, as I mentioned earlier, that hormonal dance that happens between, like, I was so connected, so intuitive with what was happening with my baby. I could feel baby moving, hubby could feel baby moving, like literally feel the movement, like
wow.
I'm like, wow,
amazing.
From, you know, front to back, I could visualize what was happening, and to then be on my back, have that taken away from me, the whole gravity helping, and then also being told when to push. I was kind of like, well, hang on, is that my body telling me to push, or this is the way to get the baby out? So that was a little bit of, that was hard, because I had full trust in my body, and then that was kind of taken away from me.
That is sad. That is sad to hear that, you know, the hospital is like, oh, you know, you have a right to say no, you have a right to blah, blah, blah. But then when it's go time, well, you don't anymore somehow. And
because it does come back to hospital policy and litigation, and I think that's the complexity of working with the system. And I know that there are some great midwives that hope for, and maybe they haven't seen as much normal physiological birth, but they know, but they are in the confines of the system too, so they have to tick the box and have the time limits. And I know that must be really challenging for them as well if they know better. But no, I did have the midwife from the movies, and she was much older. She was very old school in that sense, and I was just like, why?
I was going to say, the other thing I'm finding is also, because you can't somehow say no to the hospital, you have to bargain. You have to say, oh, I'll do this if I can do that. And that seems to work. But I mean, it shouldn't come to that. It should be if you decline something, you've said no.
As a
It's
labouring
no.
woman. Like maybe it's a
Exactly.
conversation you have before birth, but when you're in labour, that is the last thing. Like you don't want to be coming into that cognitive brain. You need to be in that primal. You really need to be in that zone. And keep drawing a woman out of that. It's like no wonder why there's so many pit stops along the way for a lot of women. It's because they're taught not to trust their body and listen to their body, or they're being interrupted.
That's it. Yeah, it feels like it's almost a privilege to birth in a hospital and have an undisturbed birth. Like as in one where you're not told to do this, to do that, to not do this, to not push, to not, and it shouldn't be that way. But again, they've got policies. Sometimes the bullying is not in their policy. I'm fairly confident it's not. They don't have to bully women, yet they choose to. That to me is unacceptable. It should be complained about, really. But
I guess one part I didn't add was the afterbirth, which is still part of birth, and sort of mentioned the birth of the placenta because it is part of the whole bigger picture. But I originally had declined the Syntocin injection because I was aware that your uterus will contract and that will birth your placenta. So we wanted delayed cord clamping, and if I hadn't passed in my birth plan, if I hadn't passed my placenta within 30 minutes, I was going to agree to the injection. And no sooner the baby was out, a midwife was like, so I'm just going to give you this into your thigh. And I was like, whoa. I was like, no, please, I don't want that. Like literally within minutes of him being born. And I said, no, I don't want the injection. And then the midwife proceeded to do, and this was when it was a bit fuzzy because I did have some gas, that I remember a midwife pushing on my belly and really like massaging my stomach, and then they started cord traction and were pulling the placenta out of me. And I knew that I was like, this doesn't feel comfortable, like this doesn't feel right. And I knew that my body would birth it. And again, I was on my back, so it wasn't, all of those things that I knew. And then I did end up having a bleed. So I did have a 1.2 litre bleed. And then they were like, okay, we need to give you the injection. We need to give you some fluids. So that afterbirth process, they technically call it active stages when they give the Syntocin straight away. But that was another thing that wasn't discussed. It was like, I'm just going to, and she had the syringe. And I was just like, whoa, stop. I was like, oh, no, I don't actually want that injection right now, but did end up having it. And that, I guess the physiological birth is not, physiological birth of the placenta is not a thing in a hospital. It potentially takes too much time and you're on the clock and they want to get you in and out. And one last thing was that it was shift change. So my boy was born at 3 and there were midwives and staff that wanted to go home. So people were coming and going, and what time was the baby born, and what was the weight, and like there was this, and I was just like, oh God, this is all stuff beyond my control that led me to the decision to potentially not have. The fears that I had around this birth was, who am I going to get on the day? Is it going to be shift change? Like all of that now is no worry in my mind because having the private midwife is not a concern.
I'm just so sorry to hear all of that, because we know, like you and I, as allied health professionals, we have to ask for consent. And consent is not, I'm just going to, palpate. Consent is, can I palpate this to feel that, and a midwife has to ask for consent too. They're not excluded from that. And saying, I'm just going to inject that is not consent. Yet they feel like they can. And as you said, things like shift change, and yes, they want to go home, and but not to the detriment of the woman's health, realistically, because what would have happened if they didn't inject you and if they didn't pull on the cord to try and get the placenta out quicker, with air quotes, is not asking for consent. Consent is, I'm going to tell you what I would like to do. I will also potentially tell you the risks and benefits of that. And then I'm going to wait until you say yes or no. That is informed consent.
Ask a question if need be. Yes. And I really do feel for the women that, one, don't have that level of knowledge to actually know, and two, the women that potentially have had other forms of pain relief where, you know, it is a blur anyway, but not, you know, just go with the flow, or just like, you know, get to the point where they're mentally exhausted, they just do whatever is recommended to them.
That's right.
But also, like I say, not, you know, feeling drowsy or potentially not quite understanding. And when you're in that space and all that stuff is happening, and like I say, if you're feeling groggy or nauseous or whatever, that's kind of in one ear and out the other, and you just go, do whatever, like that. I don't even think people would have noticed. But it's like, I'm just going to give you this, and you're like, oh yeah, it's like, oh, okay, something just happened. Like, that's how quickly it could have happened.
How was the early postpartum, and I guess when you were transferred to the postpartum ward, how was that experience then?
Yeah, brilliant. So we, because of the meconium, we had to stay, we were recommended to stay 24 hours. So I was hoping to get out of there as soon as medically ready. Like, they wanted to just check Bub and check myself. So I did have a blood test afterwards, and even though I did have I think it's more than 1 litre is a significant bleed or postpartum hemorrhage. So because I did have the bleed, they wanted to check my bloods, but my hemoglobin was actually okay. So they just gave me a bag of fluids, and then, so I was so puffy. I remember my socks were cutting in. I was just like this balloon. But anyway, that I guess was better than having a transfusion. But 24-hour monitoring for me and Bub. So went back to the ward. Hubby stayed until the evening and then came back the next morning. Again, we didn't even have the car seat fitted. That was meant to be getting done the next week So hubby's on YouTube watching how to fit a car seat before he came back to pick us up. But yeah, we had the 24-hour stay. That was really positive. The midwives that were there were very helpful, initiating breastfeeding, and I did have some colostrum that I'd taken and we'd stored, and was able to give that to Bub. And we had a sort of, you know, the first night just the two of us, which was strange because you're like, wow, just birthed this baby and they're in like this little thing, and you don't want to sleep because you want to see them. But that was nice. And then once we'd gotten home the next day, it was sort of all systems go from there. But like, I mean, given that story, and when I say it's, you know, those little things that I say frustrate me and some women may take to be sort of traumatic, I understand their perspective, and I understand if this was a woman coming into my care, like I completely understand everything as to why things unfolded the way that they did. So that's why I still perceive it to be positive. But I would say it's mostly the frustration, like I say, being informed and sort of not being heard. That was probably the hardest part. But overall the whole birth experience and then the early postpartum period, I did have the midwife came the first, I think it's the first, third, and then a week later I had the baby blues on day 3, and that was just as my milk came in. Was it just, I think, so that was the same day I decided to look at my perineum. Don't recommend that. I don't recommend looking at your perineum in the first few days after birth. But me being me, I was completely fascinated. I was like, I need to see what's going on, because I was trying to see the stitches. So and that was one of the questions I said straight after birth. I was like, did my perineum tear? And it was actually the obstetrician, the one that ended up doing the stitching for me for my labia. So it was more internal tearing and then more closer to the urethra at the front. So I couldn't actually see any external stitches. They were all internal, so more in the vaginal canal essentially, but they classified it as labial tears. But when I said, did my perineum tear? She's like, no, you push like a champ and your perineum's intact. And I was like, thank goodness, because one, I declined the episode and I'm glad. And I said, I'm happy to tear if I'm going to tear. But they said, no, you were able to work with your pelvic floor, which I was like, I would hope so. But also being in that situation, didn't know what the outcome was. So having the labial tears, in terms of healing, that was, I still had a little bit of discomfort with sitting, with feeding, so I was taking time to get horizontal when I could. But with the day 3 baby blues, that was quite funny. My husband was like, why on earth would you, out of all the times to look, when I just come down from this high of birth? Because you are, and like the birth high was incredible. I was literally on cloud 9. and what goes up must come down. And it,
Oh.
it happened. I remember my family, my mum and my brother had come to visit to meet baby for the first time. So we didn't tell anyone the day of birth. We told our family, everyone the next day. So when we got home, they came over and I said, look, I just need to take my baby into the room and just be with my baby. I was getting so overwhelmed and I was really teary.
Yeah.
Anyway, it lasted 24 hours, thankfully, and then it was all good again.
Oh, nice. And so how did you find breastfeeding? So you had all this education, you really wanted to make it work. Yeah. How did you find it?
Yeah, so my, as I mentioned, my milk came in. So I did a little bit of antenatal expressing, which again, I had learned through this breastfeeding course to start around 36 weeks. So I was doing 10 minutes maybe every 2 or 3 days, and I was getting literally 0.1 of a milk. It was barely anything, but I managed to have these 2 little syringes that I took to the hospital. He seems to think that's why I went into labour early. He's like, it's because you were doing all that nipple tweaking.
I mean, it does help to bring on labour, which is why you shouldn't start it before 36 weeks. May or may not have been, who knows, Yeah,
I actually then turned around and blamed him because he was making me raspberry leaf tea triple strength. He was filling up the tea leaf container. I was like, you meant to put a teaspoon in. He's like, oh, I've just been filling it up. I'm like, no wonder why I went into labour. But that's our little joke. He seems to think it's the antenatal expressing. But so I did. My milk came in within, I think it was day 2 or 3. So then I had that engorgement and like itty bitty titty committee usually. And then during pregnancy, I was like, wow, I've got these boobs. They just grew out of nowhere. And then day 3, I was like, it looked like I had this boob job from hell. It was awful. Like they were so rotund and like they were like melons just stuck on the front of my chest, and I couldn't lay down on my back. It was painful on my side. My arms were like this. Like it was, I was like, what is this? And so, I did have that engorgement that was quite uncomfortable. I also had, and I say had because I don't now after breastfeeding for 19 months, flat nipples, and particularly more on one side. So we had a little bit of latch issues with these rotund breasts and quite a flat nipple to try and get the newborn baby on. But he was gaining weight quite significantly. I had my latch checked with the midwife on that first appointment, and it honestly did give me the confidence. I knew to feed on demand. I knew that I was trying to feed from both sides, alternate sides, and I guess there was a little bit of a method to it in terms of frequency of feeding and looking out for the cues. And I perceived it was really quite right from the get-go. Having that education really helped shape my early breastfeeding journey. And with the oversupply, I reckon it took me 8 weeks for even knowing all of that, and a little bit of, sensitive nipples. I remember in the shower it was painful, with the towel it was painful, robe it was everything was so sensitive, but I knew that it wasn't, with the latch it might have been uncomfortable, but then if it sort of eased throughout the feed, I knew that was an okay sign rather than it being painful all the time. And there was no misshapen sort of nipple, I knew all the things to look out for that gave me an idea that it was a poor latch. So he was gaining weight, and other than the sensitivity of the nipples, there was no pain. And so 8 weeks is when it kind of started to feel a bit natural and normal. And I feel for women that don't hang in there that long because a lot can happen in 8 weeks, and it can feel really hard, especially with feeding every few hours. And it was 5 months until my oversupply settled. So I guess, I don't know, we'll go into the challenges of an oversupply, because so many people are saying, oh, that's a great thing. And I'm like,
no.
It is, because I don't have the stress of my baby not gaining weight. Like he just went from a 3.1 kilo baby to like 4 kilos in not even a couple of weeks. It was just like, woof, like he just blew out.
Nicely done.
I'm like, maybe that's what you would have looked like if you were in there until 40 weeks. Yeah, he didn't have any troubles, other than he was a bit windy, and he did have times where he would aspirate because my letdown was so violent that he would just be drowning and sometimes even wouldn't be able to latch. I've actually got a video that I have shared on my social media that he's sort of like, mouth is open and it's like a sprinkler spraying, and he's just getting like sprayed in his face. But that was the hard part, was he would aspirate and then I would have to pull him off and he would be coughing, and like a newborn baby, like choking was just not nice. And then, with that came the mess of the clothes were drenched, and I was using a boob rag and having the breast pads were, so I was using reusable ones, and I was going through like 30 in like 2 days, and I had disposables to back up the reusables, and like, so the oversupply was a little bit of a challenge. I ended up having mastitis 5 times in my breastfeeding journey, which was hard and a different experience every time in terms of the pain. Like, one came with a really painful letdown, which felt like electric shocks, and the fevers and the sweats and the feeling like you have the worst flu ever. And every time I told myself, I'll give it 24 hours. If it's not improved, I'll go to the GP, we start some antibiotics. And I never end up having to have antibiotics, thankfully, for any of the episodes, because within 24 hours, my symptom was always improved. It sort of lasted that 3 to 4 days. But and knowing a bit about mastitis before then was helpful. And I've actually done a bit more education around mastitis going into this breastfeeding journey. I'm a bit more well informed again. So I still, I think my breastfeeding journey right from the start was those sort of markers of the 8 weeks for it to feel normal, the 5 months for me to be able to leave the house and actually breastfeed in public without having like
the cover and all of that.
I was using the ladybugs, which is like a Hugger product that you put inside your bra. I know a lot of women use the actual Hugger pump, but that again was way too much suction, and I was actually getting way too much milk at the same time, so I didn't want to induce any more milk production. So I was using the ladybug, which I was getting like 70 ml as a letdown, like literally just collecting. There was no suction, it was just holding it there whilst I was feeding.
Goodness.
I was collecting all the milk and freezing it in ice cube trays, and I ended up donating it because my boy didn't need it. I donated it on the Human Milk for Human Babies, like a local Facebook page, so people in my area were able to come and pick that up and use that. I guess that was a positive, that I was able to help some other families, because we definitely didn't need it.
Well, that's good. Yeah, that's amazing. We don't talk enough about oversupplies and also donating breast milk, because sometimes, for some women, they need a little extra because maybe their supply is a little bit on the low side, or they've had to stop breastfeeding for any reasons, and they still want to be able to give breast milk to their baby. And those Facebook groups are amazing. So Human Milk for Babies, and I think there is one for every state, and you can just post on there and just say, I'm looking for this, or I have however many bags or liters of milk to donate, it's all been frozen, blah blah blah. That helps. That actually helps. If you think, I don't know what to do with all of this freezer stash I've got that I'm never going to use now, then jump on that Facebook group, because it's amazing, and usually someone within your area within a few days will pick it up gladly.
I ended up having a lady that picked up all my colostrum, like, because it was the early days, and like I said, there was so much that she wasn't sure if she was able to, because she had breast surgery, so she wasn't sure if she was able to feed straight away. And so I donated that to her, and she ended up getting back to me and saying, thank you so much, that was like really helpful, because it was a little bit of her milk took a little time to come in, and it was really nice to hear her story. And then the other lady I regularly donated to was a twin mum. I think her girls were over 12 months by that stage, so she was happy to be grateful to have whatever. I thought that was nice as well, just to know that you're helping another family. It's a good feeling.
Yeah, exactly. And it's not spoken enough about, but it is great. And I mean, if you can help someone to help their baby, why not? If you've got the bags, and I've seen people that have donated, you don't need to have 3 liters by any means. If you've got 200 meals, 500 meals, that can get a mum, sometimes you're just getting to the end of your stash, and maybe you've got someone who's regularly pumping for you, but maybe they've been sick, or life happens, and sometimes just getting that little bit, and to me there is never a little bit of breast milk, is enough to see them through, and then they can just wait until they can find more and whatever. And it's just such a great feeling when you as a mom, you're helping another mom, just this community feeling is amazing, I feel. And this is where we finished the conversation with Amber because we experienced some technical difficulties. So luckily we got to record her whole birth story for her son. I hope you enjoyed this episode, and I hope you enjoyed listening to Amber's incredible birth story, and we wish her all the best for her upcoming birth of her baby boy or baby girl. Thank you for listening, and I hope you enjoyed this episode. If you want to get notified of when a new episode comes out, please subscribe to this show on your podcast listening platform. Also, I would really appreciate it if you could leave me a review on Apple Podcast or share this episode so that other moms can find it. If you would like to tell your own pregnancy, birth, or parenting story, please head to the show notes and you will find a form there to get in touch with me. Again, thank you so much for listening, and I will be with you again next week for a new episode.